This video will review potential complications and their prevention after partial knee replacement. Infections can occur in about 0.5 to 1% of patients after partial knee replacement and typically occur either in the first 8 weeks after surgery or years later. Risk factors for infection include morbid obesity, poorly controlled diabetes, conditions or medications that suppress the immune system, poor nutrition, and smoking. Wound drainage is also a leading cause of infection and should be addressed immediately by alerting your care team. Signs of infection include increased pain, swelling, redness, fevers, and wound drainage. Infections may require surgical debridement and treatment with oral or intravenous antibiotics. Fortunately, infections after partial knee replacement are rare, but they can be serious. And here are a few ways to prevent them. Avoid submersing the incision underwater for at least 3 weeks. Monitor your incision for any drainage and alert our office immediately if this occurs. Keep soiled clothing away from your incision. Keep your hands clean at all times during dressing changes. And optimize yourself in terms of the nutrition and supplement recommendations in the preparation section of this guideline. Major blood loss is not common after partial knee replacement, and the risk of needing a blood transfusion is well less than 5% after this operation. Some blood loss is expected and may lead to some fatigue in the first few weeks after surgery, which is normal. Your body will build back its natural blood stores in time. Damage to major blood vessels at the time of surgery is extremely rare. Damage to major motor nerves around the knee is very uncommon. Some numbness on the outside of the incision is normal and occurs in all partial and total knee replacements. This will be noticeable early after surgery, but becomes less noticeable over time and does not cause any functional limitation. Blood clots in the leg are rare but can occur after any kind of joint replacement, and the best prevention is early mobilization and prophylaxis with blood thinner medications. If patients develop signs and symptoms that may suggest a blood clot, we will generally order an ultrasound study to evaluate for this. Patients who develop a blood clot will need to be treated with anticoagulant medications for up to 6 months. Alert your care team if you develop symptoms of a blood clot, which include increased calf or thigh swelling with pain and warmth. As mentioned, all patients are placed on some form of blood thinner for 30 days after surgery. For most people, we use aspirin, 325 milligrams twice a day. For people with a history of stomach ulcer disease or kidney insufficiency, we may use aspirin 81 milligrams twice a day or sometimes once a day. Patients who are already taking blood thinners such as Eliquis, Xarelto, Plavix, or Coumadin are restarted on their regular medication the day after surgery. The following steps can lower the risk of blood clots: elevation to reduce swelling, regular exercise and mobilization, and ankle pump exercises. Other medical complications are also possible. Surgery is a stress to the body, and patients with medical problems such as heart, lung, or kidney disease may experience medical complications from surgery. Optimization of these medical problems before surgery is critical, as is customization of the care process to prevent complications. Make sure your care team is aware of any medical history that may affect your risk and recovery.